Hello everyone. Today we're going to dive into the important clinical test used in assessing arterial insufficiency called Rubor of Dependency test. This test helps us understand how blood flow responds to changes in limb position relative to the heart.
So when performing the Rubor of Dependency test, you want to make sure that your patient is in supine and that they would have rested for about 5 minutes before performing the test. So to start, you want to get a good idea of the color of your patient's lower extremity, foot, and ankle. If you want to, you can kind of do a capillary refill, see how that's looking. But then to begin the Rubor of Dependency test, you would take the patient's leg, raise it to about 45 to 60 degrees, and you're going to hold that for a minute. And monitoring the color of the ankle, foot, lower extremity. A normal finding would be if the color stays about the same, but an abnormal color would be if it starts to turn very pale, which would indicate arterial insufficiency. So once we hold the leg in this position for 60 seconds,
1 minute later,
we would then lower the lower extremity and have your patient long sit and bring their leg immediately in a dependent position. So from here, a normal finding would be within less than 15 seconds that you would see the color of the ankle, foot, and lower extremity returning to a similar color of the opposite lower extremity. An abnormal finding of this would be if the lower extremity you tested starts to turn bright red and or is very painful.
All right, so this is again the Rubor dependency test, but this is going to be considered an abnormal finding. So what we're going to first have is the patient is going to be in the supine position for 5 minutes. And once those 5 minutes are up, we're going to check for circulation. You can do this before the 5 minutes or after the 5 minutes, but just check for circulation in the foot, make sure the blood flow is good. And then you're going to raise the lower extremity up to 45 to 60 degrees approximately for a minute. During this position, we're going to be looking for paleness of color in the foot, especially in the plantar surface of the foot, and then note for any just other signs, especially the colors of the big ones. And then after the minute is up, we're going to be going into the dependent position where the patient is going to be sitting up on the side of the bed. We're going to lower the leg down here, and we're going to be looking for a positive abnormal finding is where the bright redness of color is coming, and we can actually already see it in the foot compared to the right side. We can see the left side here having that bright redness of color, and that would demonstrate a positive test for the or abnormal finding for the Rubor dependency test.